This podcast was produced thanks to the support of York University and the Faculty of Liberal Arts and Professional Studies, thanks to the Dean's Award for Research Excellence or DARE program. Special thanks also to the CSIW team, which contributed to the necessary research and debate that constituted the pre-production process of this piece. In particular, thanks to the project supervisor Dr. Bunting and to the project assistant Bruno Véras. The aim of this podcast is to bring you an interview with members of NGOs in West Africa and to understand the issues and necessities of their beneficiaries and themselves during COVID-19. Thank you for listening. Beginning with me, I'm Lorenzo Serravalle, and I am undergraduate student at York University. I have been working with Professor Bunting, that you obviously know, Rosaline, and I have been working under CSIW, the CSIW team, Conjugal Slavery in War, and I have worked in this team mainly on knowledge mobilization pieces. Today, I'm here as a researcher with a research project that has been put forward by the university and by Professor Bunting, and it is focused on COVID-19 and the impact that COVID-19 has had on women and girls, but more importantly on NGOs in West Africa.
Okay. Well, I should say we are two of the same kind because we have been working with CSIW and with Professor Bunting for some time now. I happen to be the lead researcher for the CSIW project in Sierra Leone, working with Women's Home Sierra Leone, which is the Women's Home Sierra Leone is the national women's umbrella organization, which has a number of all the nationwide organizations, women's organizations, who are working on gender equality and other issues. We have done work with victims of sexual violence in the war, and even researching on the CBOWs, as you may know. Mm-hmm. And we have also been working in the communities on gender-based violence and so on. And right now we are supposed to be having community engagements of various kinds in the various communities, especially with our VSLA groups, Village Savings and Loans Association groups that are in Matujong, Bo, Kenema, Kailango, and in the Warwooded camp in Freetown.
Great. It's nice to meet you, Rosaline. And again, thank you for being here. And thank you for bringing your immense expertise to this conversation. I think that we may start, if that's okay for you. Starting from the first one that is based on academic research, because before making this interview, I have made some research and I have made this list of questions that are useful for our arguments. And the first one is one of the topics that were mainly addressed in these articles, and it is the financial topic. Because in scholarly research, the financial impacts that COVID-19 had for NGOs was explored in many ways. And I would like to know your opinion on your work and your experience and the impacts that COVID-19 had financially on the organization you work with, but also on the staff you work with.
Yes. Well, I will only speak for myself and for our own interactions with the CSIW projects. I wouldn't know much about what has happened with other NGOs, but I suppose basically we are all aware of the restrictions brought on by the COVID-19 and the focus on health issues and the socio-economic impacts of COVID-19. So as far as we are concerned, we have an annual grant, which we receive. And we receive this amount based on an invoice that we send to the projects organizers, and they remit the money through our bank accounts, our project bank accounts.
Mm-hmm.
And that did not depreciate, that did not reduce. But we have constraints working with this amount. For example, before COVID started, we are supposed to have this exhibition. People, our partners coming out to Sierra Leone, and they had already sent some money to cover some basic expenses. We had already started meeting with stakeholders like the Peace Museum and with our own people at the War Wounded Camp. But the money is still sitting down. Mm-hmm. Because, if I may put it that way, because they have not been able to come out, and obviously, if they don't come out, then we won't get to spend the money. That is one. But definitely, the amount was sent. And even the other amount for the community engagement that we have annually was sent. And it was not reduced. But the only constraint is that we have not been able to use it as according to the way we envisaged. I say this because, Freetown is the capital of Sierra Leone, but most of our work is with people in the regions. Mm-hmm. So what with the travel restrictions and the fact that people could not group together in large numbers, we have not been able to match up to our expectations. Mm-hmm. I think also that probably some other organizations that were expecting funds to be transferred had some challenges, because probably, I'm not saying this for sure, but it's like probably some of the activities they had laid on, they could not access the funds.
Mm-hmm. Mm-hmm. And I thank you for your response, because it was very argumentative, and you included as well the probability of other organizations possibly having reduced fundings. But I think that maybe your connection with an academic group rather than a governmental group or a private funder may have provided the availability of a constant income.
Well, if I may come in right there, it's like, with the exception of CSIW, most of the time we out here are not funded on a programmatic level, so that it's on a project level that we get our funds. So there is the element of sustainability there. Even before COVID, you had this problem of sustainable funds for most of the NGOs, especially the women's organizations that are the local, national women's organizations. A few of them may have been fortunate to get sustainable funds on a programmatic level. But for some of us, it's hodgepodge here and there, as and when, apart from CSIW, which have really been good to give us this sustained funds for a particular activity or group of activities to work with our children born of war or the victims of sexual violence in the war and so on. But we have this problem as even before COVID, and it has now been exacerbated by the COVID, this problem of sustainable funding based on programs over covering a period of, say, 3 years or 4 years and all of that, with the exception of CSIW for now.
Mm-hmm. So you mentioned this unavailability to organize events. Has this impacted the communities you work with as well? So has COVID-19 posed an obstacle between you and your beneficiaries? And in what ways in particular?
Well, we have people on the ground. We do not always have to move to our areas of activities to make an impact. We have representatives and we can call them on the phone, send them texts, get them on WhatsApp and all of that. So this is what we have been using for the most part. But that does not mean that we have not been able to benefit. Because before COVID, we were able to make our presence felt often. And this has had a lasting impact on them. And with our representatives and the groups that we are working with, we expect that these representatives will be meeting with the clients, the constituents, as and when from time to time, especially in this case of the VSLA, where they have to have meetings to sort their money business out, to make their contributions. So the long and short of it is that they have not missed out completely because we have our representatives on the ground who meet with them from time to time to talk with them, and we also engage them by telephone, by text, by WhatsApp, and all of that.
I ask these questions because we have already had other interviews before this one, and oftentimes it was mentioned that the lockdowns were a great obstacle between the organization and the community, especially if the community was not only in other regions, but mainly in rural areas. So what are your reflections on this? Have you experienced this as well?
We experience lockdowns, restrictions, travel restrictions, and all of that. But what I'm saying is, whenever it is possible, the people on the ground continue our interaction. There is a certain amount of continuity. Of course, it won't be the same as pre-COVID, but definitely there would be a complete breakdown in communication or interventions. You know, we have a team who will go around to facilitate and all of that. Probably we will not be able to go as often as we would like to go. But that notwithstanding, there are people on the ground because our organizations are national, and this takes into consideration the regional components. So there are always people, I can call their names. If you go to Matu, you have somebody there. You go to Bo, there's somebody there. You go to Kailau, there's somebody there who is representing us, who is part and parcel of the big group.
So you found in using messages, phones, a way to overcome the obstacle that lockdowns were. That's my reflection. But I wanted to connect this fact about the using of technology in terms of social media.
Well, if I may come in here, social media has been very useful. But the gap here is how useful and to which categories of people. You find out that those people who have phones, and more so those who have WhatsApp phones, are able to receive messages. But there is a problem, that of internet connectivity. Sometimes internet connectivity is a hindering factor when you want to communicate up country. That is one. So, and also in some areas, it can be difficult. For example, in some riverine areas, it's not everybody is on email, or not everybody has WhatsApp, or even if they have it, they cannot access it all around. They have to go to a particular spot to be able to send WhatsApp messages. You know, some of them don't even have email addresses. But the fact remains that in every location, we have at least one or two. But then you also want to look at the literacy level of our constituents. Some of them are non-literate. I don't want to use the word illiterate. They are non-literate. And Some of them may not be able to communicate one-on-one by on the phone, except if you were to use voice messages. Then you could speak in your own local language. You can speak in Mende or Creole, as the case may be, and they'll be able to understand you. And these people are also not able to read texts, these non-literate ones, but you can also reach them by audio, by voice message. So plus or minus, we set great store by the social media. It's been a great asset in these times, but at the same time, there are hindering factors. But we thank God that we are not in limbo, or totally, at least we are able to connect as and when.
While remaining in the same topic, I would like to ask you further questions about the possible restrictions that COVID may have had for your organization, because in particular, we are studying how COVID impacted you in terms of your ability to organize programs. So I wanted to know whether you had, as you already told me, you had one program that was canceled, but I wanted to reflect further on this topic.
Well, we have done our best, but all the restrictions, the social distancing, hand washing aspects, the numbers of people to be involved in any activity at any one time, and even there have been cancellations, because COVID is a pandemic. And this has caused nations to try to put in measures to ensure that we do not have too many deaths or too many people being infected. All of this puts restrictions, whether you like it or not, on people generally. So as they continue to monitor, for example, we had about 3 weeks, restrictions on church services, mosque services, clubs, restaurants, meetings, and all of that. And we even had curfew, which has still not been lifted. So all of these restrictions, they have psychological implications on people, as well as socioeconomic impacts. People have not been able to meet. So all of this is impacting on the programs as well, because that's social elements. For example, our VSLA women, they were used to going out to buy their wares, to do business, and all of a sudden there were restrictions on their movements, especially in the early hours or late at night, And even there was a time when we had a ban on travel up country, you see, and people could not go. So with the ban on travel up country, obviously you will not go, they will not go, Then of course, even the decisions in terms of wearing masks and all of that, that too has had its own effects. Some people do not believe in that, but they have to. And even in the early days, a lot of focus was on counteracting this COVID thing. And so there were some other services that were left unattended to. Even some people were afraid to go to hospital because they didn't, in their own words, they didn't want to get this COVID. And sometimes when they went, they would complain that, oh, they didn't have this medicine or they did not have that medicine, and because everybody was now focusing on COVID. Even with the vaccinations now, some people still don't want to take the vaccine. Some people will take it, but there are restrictions that if you don't take the vaccine, if you don't have evidence of this one dose, you won't be able to access public buildings, So it's a mix of factors. You have the psychological factors, how the people are feeling in themselves, this kind of curtailment in quotes of their freedom, brought on by COVID, you know, the socioeconomic impact, the loss of income, and so on. You know, and then of course this is also felt at organizational level, because some people they set great store on meeting people at different times at meetings, but now they could not, because there were restrictions of the numbers and so on. I remember we had a meeting in Kailau. We invited the people from Kenema to go to Kailau, and we had a big crowd there. And we had about at least 50 or 60 people all together before COVID. But now you cannot do that, you know. So sometimes you even rely on the representatives in the regions to go ahead with the project with guidance from you, even if it is to anything that involves financial disbursements. You rely on them to disburse and send you the receipts and retire the funds. But definitely you cannot have that large group anymore until we have new developments. And now even we are hearing care of the Marburg virus in Guinea. So we are just praying that that will not interfere with us, because we already had Ebola, we had flooding. Recently, we observed the 4th anniversary of a mudslide that occurred in 2017 that led to so many loss of lives. So all of these things are impacting on programs. All the same, we are hoping that we'll be able to do some programs.
COVID put more pressure onto the already much pressured situation that there was before. I have one main question that I wanted to ask you about gender-based violence, because research has shown that restrictions imposed to fight COVID-19, thinking about curfew, for example, were found to be the context in which gender-based violence and domestic violence, for example, were able to thrive. And there were also mentions of forms of violence that can be understood only in the context of the pandemic. And I wanted to know your reflections on this, and if you have any examples you can think of.
Gender-based violence is all over the world. That's why we have been training on gender-based violence, raising awareness. Our government has done a lot. We have model courts on sexual and gender-based violence. We have high levels of the cases are being reported, and we have a revised sexual offences law that really focuses on rape and penetration and all of that. So what I can say here is that for the intimate partner violence, there has been a lot of it, this domestic violence, because now it's like due to the curfew, you have many more people, partners, husbands and wives and so on, tend to spend much more time together. And that is one. And as long as you have partners coming together with all the restrictions, some of these men have lost their jobs and their economic problems in the home. And these are the root causes of all the violence. And some people, maybe they would just feel that they are being restricted, so that the bickering increases and the kicking and the this, that, but basically all will boil down to intimate partner violence, domestic violence. But that notwithstanding, and even teenage pregnancy, because when there is a shortage of what should be within the grips of somebody, you have other people taking advantage of young girls because their parents probably cannot afford some of the things that they would want. Even some of them, the 3 square meal is no longer forthcoming. So all of this gives rise to all kinds of violence. We know that there has been a lot of increase in sexual and gender-based violence, especially the domestic level. But the government has reacted in a very strong way, so that you have, I think the minimum sentence is about 15 years. So, but basically there has been an increase because people are no longer free to move around. They are like in confined spaces. And what with the socioeconomic problems, you have all of this violence. SGBV is all over the world.
Yeah, that's definitely true. And as we have said, I believe that the context of COVID-19 accentuated this issue.
Yeah.
As much in Sierra Leone as much as anywhere else
All
in the
over,
world.
yes.
Mhm. You highlighted socioeconomic issues as one of the ways that can be the spark for intimate partner violence. And I wanted to know more a little bit about socioeconomic issues, but more in particular about the socioeconomic issues that affect women and men differently.
Well, basically, these issues revolve around what should happen, what should exist, what should be provided for the welfare. So we have in our local balance, we have what we call job money, money for food. The head of the house is the man, and some of the men are able to give this money on a monthly basis or on a daily basis or on a weekly basis. But it's like some of these men now lost their jobs. Even the women who were busy, most of the women are business women, and they will go out in search of items for sale. But if there are restrictions, then they too will not be able to get as much money to feed the home or to even support their children in school. And some of it, this violence comes really out of frustration on the part of the man. You say, look, I am the head of the family and I'm supposed to be providing this, that, and the other, and now I cannot. And possibly this woman cannot even understand that I am not able to do it because I do not have it. Again, it depends on the level of understanding between the man and the woman that existed even before COVID. For some men are not transparent in their financial matters. So all the time it leaves the woman to feel that, oh, this man has money and he doesn't want to give me. And sometimes when the man does not own up to his responsibility, it has issues of maintaining his own self-respect in the home. Some women are not able to handle it properly, and that really breeds us a lot of violence. You know, they don't understand because the man may not have been transparent enough, or she feels that the man has the money, but basically it has issues of frustration on both sides, and it depends on the way each partner handles the situation. But it revolves really around the welfare of the family, food-wise, in terms of providing for the needs of the children. The children have to travel to school, or if when there was no school because of the COVID restrictions, and or if the children are on holidays as it is now with us, then they have to eat more and they have to play around. They have other things that should happen for them to be happy. If all of these do not exist, what do you expect? And those are the things. And of course, it has to do again, as I said, I mentioned self-respect and with the man's ego. If the man's ego is jeopardized, then of course it can react violently. And some of them also, they take other things, drugs, alcohol, all of those contribute to violence.
It's almost like the same process that we've talked before about COVID-19 accentuating already present problems.
One other thing, in our parts, you have the issue of accommodation. Because some people, you cannot imagine they live in a one room and parlor, if you put it that way, with the husband, the wife, and 3 or 4 children. So before COVID restrictions, they were able to go out, get some fresh air. But now with COVID restrictions, they are like in the home all the time, especially when we had the curfew starting very early in the evening. But now it's from 11 to 5 o'clock in the morning. So this issue of accommodation also is breeding violence, sexual and gender-based violence. Some people they sublet. Maybe you have an apartment with 4 rooms, and each room is occupied by one family. So you have 4 different families or 2 different families, as the case may be, in one house. So it has implications for the children's experience. I don't want to go too much into that, but it has implications for the children's experiences in terms of what they see happening and in terms of what the other tenants, co-tenants, are likely to do to them. Because some of the children, they are bound to sleep in the parlor, in the sitting room, because there's only one room, and the parlor is shared by all of them. So this housing problem is also difficult.
It's another aspect of COVID-19.
It is, and most of the time, people don't tend to look at it that way, but for us here, it is. It is, yeah.
The last question is a bit more open, and it talks a little bit more to your opinion and your personal feelings as well. As I wanted to ask you if you were optimistic about the future of the pandemic, the future of the situation, if you believe that this situation will improve, but also what are your necessities now? What do you need to fight the impacts that COVID-19 has had? And what do you feel that your beneficiaries need to fight the impacts of COVID?
Yes, I am very optimistic. Aren't you? Aren't you optimistic? It will pass. It will pass. Everything that has a beginning definitely will have an end. It will pass, but we too have to make our own contribution to how soon or how much later it's going to be with us. So we have to be careful, because if we are not careful, we are really going to be in deep trouble. But definitely there have been plagues in the past. If you read history, many plagues, they came and went. Ebola for us came and went. I think Ebola was with us for about 2 years or so, and it's gone. So we have to keep on, even now that our numbers are reducing. So I am optimistic. I've been in the development process for a long time, and I know that God will help us, but we too will have to help ourselves to obey the rules. We cannot afford to be too removed, if I may put it that way, from our regional people. We have to be visiting them, monitoring what they are doing. So if we continue to have these restrictions, we'll not be able to do that. We need to really look up, but we need to help. And we are in the process of doing that, to help them, because some of them have lost a lot. Profits are very minimal, and some of them have large families, some of them have lingering ailments right from the war. Our war ended in 2002. Up till now, they have lingering health issues that need to be taken on board. They need to be helped with. Definitely, there is a great need. We are a nation, we are in need, especially our constituents. We are in need. Women are in need. We need to go to them, talk with them, help them out. We know their problems, but there is a great need, I can tell you. When you can do the research, yes, but when you do the research, as I always say, what next? How does it trickle down to the constituents in the villages? There has to be a real response to socioeconomic issues, more response to people's needs. Here, we still have to grapple with these basic needs, As I told you about connectivity, internet connectivity, you have issues of water, basic needs like water, food, Some of you need to come out and see for yourselves what I'm talking about. But in the midst of all of this, I remain positive that things will happen. But for the COVID, we have to obey the rules so that we get out of it faster.
I guess that your advice is to remain stuck to the rules, but also at the same time help those who cannot follow the rules and help them to follow the rules.
Well, you can help them to follow the rules. We have to help them.
Mm-hmm.
We really have to help them.
I think that we have covered everything that we expected to cover. I think that we also overexceeded our time limit, and I would like to stop here and to thank you, Rosaline, for being here and for sharing your expertise with me and with every listener that will listen to this podcast.
Thank you for thanking me. It's good for men and women to be talking together, and also it enhances the intergenerational dialogue.
Yes.
You talking to me.
Yeah,
Thank you very much, Lorenzo, and I wish you all the best.
Bye-bye, Rosaline. Thank you.